is Older American Month, and our senior population is growing rapidly. The CDC says the average life expectancy now is 78 years old. So it's important to stay aware of our bodies as we age.
And Dr. Ishita Sharma is a geriatrics care physician at Kaiser Permanente Downey, and she's here to talk about the common challenges for seniors and some recommendations to help. Dr. Sharma, thank you for being with us this morning.
Thank you so much for having me here.
We all joke about feeling old, but let's talk about what age range are we actually discussing here?
So, that's a very interesting question, because I would say aging is a spectrum.
Yes.
Right? And healthy aging is something that we don't put like a number to it. And so I would say anything that is modifiable, so right from your 40s all the way to 120 years, I think, we consider that to be an age spectrum.
I will say, I was just reading the other day that we actually start the aging process in our 20s, whether we want to believe that or not, right? It seems like we're still developing ourselves at that point in time.
Yes.
I think most people think like 65, 70 might be when you're kind of starting to enter the senior years, more golden years of your life. What can you do to stay independent as long as possible? Because I know my mom is turning 70. Her mother lived to be almost 95 years old. So she's looking at the next 25 years of like, how do I plot this out?
Of course, this is such an important question. And I think I would recommend our adults over the age of 65 to really be very proactive in their own health. I would recommend that they advocate for at least an annual functional assessment, which includes gait stability, which includes like their balance, their muscle strength assessment. I think that's very important because that's what helps them stay independent. And they can always talk to their doctor's appointment and see, if certain Medicares, for example, they have gym membership included in them.
Yes, that's true. My mom just figured that out.
Oh, well, that's great.
Yeah.
The hard part, I think, with a lot of seniors is they don't feel that decline happening, right? So you're saying, I think you should go get this assessment, and they're like, I'm fine. How do you convince them that this is something they should do to be proactive?
I think, falls are a major cause of injury. And so maintaining a good muscle balance and muscle strength is very important. And so that's why I think it's very important that they have the annual screening. I would also recommend that they should maybe talk to their doctors about med reconciliation. And what that means is basically the focus is de-prescribing medications that are not necessary. Like psychotropic medications, they increase your risk for fall. And so it's I think, super important that they address those things. The other thing I want to talk about is hearing.
Yes.
Hearing is one thing that we don't always associate with change in age. So I think even when you're 50 years.
No one wants to admit that they're having an issue with their hearing.
With the hearing, because it leads to social isolation. And social isolation leads to like decline in every sphere as we grow.
So the other thing I was thinking about the other day after talking to my mom too is that a lot of people I don't think realize as they're leaving the working world and they're getting on Medicare, Medicaid, those types of plans off of kind of their employer health plan, there can be big changes in the costs of things that they really need to talk to their doctor about, whether it's prescriptions or even the visits to the doctor.
Yes. I think you bring a very important question around affordability. And affordability, I want to say, is actually a twofold question because there's like direct costs involved and then there's indirect costs involved. So like 16.6% of Americans are over the age of 65. And so they experience a massive barrier when it comes to navigating the complex Medicare plan system and coverage system and the rising costs of, co-pays and all the other medications. So I think like at Kaiser Permanente, we do have medical financial assistance to help our patients with that. It's a pretty simple process to get it. And I think in the outside community, they can definitely talk to their doctors and see if there's any kind of discounted programs. Sometimes drug companies will offer coupons for medications. Certain foundations will offer ways to mitigate some of those expenses. So I think that's super important. And now, beyond prescriptions, if you talk about like indirect costs, I think we want to address long-term care. So, nursing homes or assisted living facilities, very expensive for the average family. And so I think one option would be to look and see if they qualify for Medi-Cal. Kaiser Permanente does have things around in place, to help mitigate some of this food insecurity and
Yes.
housing insecurity. So I think, in today's day and time, that's super important, right?
And these are all things that we should be talking about.
Absolutely.
So, especially as the population ages. Thank you so much for being here this morning. We
You're
really
welcome.
appreciate
Dr.
having
Sharma,
you.
so nice to meet you.